Hi, my name is Peter. I grew up in a town called Broxburn in West Lothian, which is in the central belt of Scotland, and I currently live in Bradley Stoke, and I'm a clinical scientist working in the public health lab at Southmead Hospital. So my upbringing was similar, I guess, to many other people. I grew up in a Christian family, although I wasn't particularly aware of that as a young child. I was the first child. There were 4 sisters who came after me, but in my earliest days there were 2 sisters, and I remember the very first time I went to church. The church was an upstairs building. It was quite an old-fashioned building, but not really a traditional church, and there was an air vent in the roof. And somebody sitting beside me said, "Look at that." And I spent the whole service looking at this air vent, waiting for something to happen, and it never did. So that was my earliest experience of church. I didn't go to church services very much because I was too young, but there were some young people's events that took place in church. On one occasion, I'm told, although I don't specifically remember, that a missionary that our church supported came home from Nigeria and spoke at one of the services for young people. And the outcome of that is that later that evening, when I was in bed and I was praying with my mum, and I gave my life to Jesus, I became a Christian. I trusted in Jesus, and I don't really remember the feelings. I don't really remember much more about it than that, because it's a long time ago. But that was when I became a Christian. So I was aware from that point on that I was a Christian, that I was part of a Christian family, and I belonged to a church. In many other ways, my life was just the same as that of my classmates at school. When I was 15, a new minister came into town, and this minister used to lead a summer mission team. He met my mother because of some sort of church event, and told her that he ran this summer mission team. And when he heard that she had a family, perhaps some of the older children would like to join this summer mission team. And I was very apprehensive about that. If you can imagine a fairly self-conscious, geeky 15-year-old, the idea of joining a team with a bunch of people who I've never met and going off to some place where I've never been in order to do Christian mission work, that did not appeal to me at all. However, there was a preparation meeting taking place. I reluctantly went along, and I was amazed at just how nice these people were, how friendly they were. Immediately felt part of them, and came home and said, "I'm going on summer mission." All sorts of things happened at summer mission. It was great, and I think it had a big impact on my life as a Christian, on my thinking, and my consciousness as someone who is following Jesus and wants other people to do the same. So I went to summer mission for many years. Started off when I was 15. When I was 18, I left school and went to Edinburgh University and did a biology degree. Didn't really know what to do after that, but one of my lecturers found some money for a PhD studentship. So I did that for another 3 years. At the end of 7 years at Edinburgh University, I was ready to leave home and didn't really know what to do, but I saw a job in St Thomas's Hospital in London. I went down for the interview and was offered the job and moved to London. So big change at that point in life, leaving home, moving from Scotland to London. Eventually I settled down in Kentish Town in North London and went to a local church there called Kentish Town Evangelical Church. I was there for 9 years, I think, and at my work I met my wife, and so after 10 years in London we got married and moved to a different part of London, so moved to a different church. By this time I'd finished my initial postdoc work in London and had got a lecturer's job, but that was beginning to peter out, and then an opportunity came to move to Bristol for a slightly different job as a clinical scientist. So I've been doing mainly research type of work, but now this job was to provide a clinical service. The slightly complicating fact was that it happened at the same time as my wife got pregnant, and we moved from London to Bristol with a 5-month-old baby who has just last week gone off to University of Lincoln to study chemistry. And so for the past 18 years, we've lived in Bradley Stoke. So we moved to Bristol in 2002, and I had this job at the Public Health Laboratory. It wasn't called that at that time. It was part of the Public Health Laboratory Service. And basically, the laboratory provided and still provides diagnostic testing for infectious diseases, for the local hospitals, and for the GPs around Bristol, Bath, Weston-super-Mare. We also do some testing for other laboratories around the southwest region because we're a specialist centre. And my job as a clinical scientist was to be part of the management team that oversees that work and to provide clinical advice, interpretation for the results, and to help apply the testing to the patients who were being tested. That laboratory is now part of Public Health England, which is about to change again, but anyway, we're still Public Health England. And everybody who works for Public Health England has a line in their job description that says you may be required to assist in the response to any pandemic or incident or emergency event, because that's part of our remit. So everybody who works in the laboratory knows that you may at some point have to drop what you're doing and do something different. And that's happened twice in the past 18 years. So in 2009, we had the swine flu pandemic. And that was a huge event for the laboratory. We were doing lots and lots of swine flu tests for all sorts of people around the region and for other parts of the country where they were overwhelmed. And so we did some of the testing for other parts of the laboratory. But it didn't really have a huge impact on the country as a whole. And then, so after swine flu, we went back to normal. And then in January, February 2020, COVID-19 happened. And it fairly quickly became clear that swine flu was a walk in the park compared to COVID-19. Because whereas swine flu didn't really have that much impact on the country as a whole, here we were doing our job, and on the front page of every newspaper, day after day, they were talking about our work and talking about viruses, which we work with. And this is a completely new experience for us because normally our work is very much in the background. Nobody really sees what we do. But suddenly we're under intense public and media scrutiny. And you've seen how that has played out over the past few months. And so for the past 6 months, probably the main bit of our work has been to provide the diagnostic testing for COVID-19. And that's been my job. It's kind of eased off over the summer as the numbers went down, but now it's all coming back up again, and the workload is increasing. So we're still trying to do our usual job, which is all the other infections which are still happening, but we have on top of that this big task to deliver the COVID-19 response. I was taken by surprise as much as everyone else was, even although it's in my job description, because nobody knows quite how it's going to play. Nobody knew it was going to be such a big event in the life of the country, and indeed at a global level. So it took everybody by surprise, really. Looking back over my life, I would say I would never have guessed the things that have happened to bring me to this point. And in one sense, I've been just as affected by COVID and the stress and the lockdown and the uncertainty and the fear as everybody else has, even although I might like to think that I understand it a bit better than other people. In fact, we're all learning about this as we go along. As a Christian, I do believe that God has a plan for the world, and also quite amazingly for me and for every individual. And so although I can't say that I understand what's happening and I understand the way my life is going and where it's going in the future, it's a great reassurance to know that God is in control of this situation. God has a plan, and he will work it out. What I think I would like somebody who's watching this to take away from this is that ordinary people doing ordinary jobs can be part of God's plan. God calls all sorts of different people to be his followers, to become Christians, and to be his people, his church here on earth. I'm thankful that he called me to be part of that, and perhaps he's calling you as well.